Here we're going to go over the top 6 medications every EMT should know. We'll go over the dose, indication, contraindication, route, and mechanism of action. We'll begin with aspirin. So the dose is 160 to 325 milligrams, which are commonly given in 4 81 milligram baby aspirin chewable tablets. Give aspirin if there's a suspected heart attack or myocardial infarction or chest pain of cardiac origin. Do not give if they are allergic to aspirin, have active GI bleeding, bleeding disorders, children with viral infections, or a suspected head injury. The route is oral or chewed for rapid absorption. The mechanism of action. So aspirin will inhibit COX-1 and 2, blocking the synthesis of thromboxane A2, which causes platelets to clump, causing the blood to clot. This reduces the clot formation, helping to restore blood flow during a heart attack. Now let's go on to nitroglycerin. The dose is 0.3 to 0.6 milligrams sublingually, and you may repeat every 5 minutes with a maximum of 3 doses. Give nitro if there's chest pain due to angina or suspected myocardial infarction. Do not give if the systolic blood pressure is greater than 100, the use of any erectile dysfunction pills is being used within the past 24 hours, or if there's a head injury or suspected stroke. This is given sublingually in a tablet or spray which is underneath the tongue. In the body, nitroglycerin is converted to nitric oxide, and that activates guanylate cyclase in smooth muscle. This increases cyclic GMP, leading to vasodilation, primarily in the veins, reducing preload and myocardial oxygen demand. It can also dilate coronary arteries to improve perfusion to the heart, increasing blood flow. Now let's go into epinephrine, or adrenaline. So the dose is 0.3 milligrams in adults and 0.15 milligrams in pediatrics, which is half that of the adult dose. It is given via an auto-injector. So usually you'll see people have these on them. And the indications are anaphylaxis, which is a severe allergic reaction, and there are no contraindications if there's a life-threatening allergic reaction. The route is intramuscular via an auto-injector to the lateral thigh. So epinephrine stimulates alpha-1 receptors, which are involved in vasoconstriction and raising the blood pressure, beta-1 receptors, which increase heart rate and contractibility, and beta-2 receptors, which are responsible for bronchodilation. This counters airway swelling, hypotension, and bronchospasms during anaphylaxis. So drug number 4 is albuterol. So the dose is 2.5 milligrams via a nebulizer or 90 micrograms via a metered-dose inhaler, which people have on them commonly. And indications are asthma, bronchospasms, and COPD or reactive airway disease. Contraindications are severe tachycardia or hypersensitivity to albuterol. The route is inhaled via a nebulizer or MDI with spacer. Patients will often have an inhaler on them. Albuterol will bind to beta-2 adrenergic receptors in bronchial smooth muscle, activating adenylate cyclase and increasing cyclic AMP. This will relax airway muscles, leading to bronchodilation and improved airflow. So now we can go into oral glucose, number 5. The dose is 15 to 25 grams or a tube of glucose gel. So this is given during hypoglycemia in a conscious patient able to swallow. Do not give it to an unconscious patient who has an inability to swallow or a high risk of aspiration. The route is buccal, which is between the cheek and gum. Oral glucose provides a rapid source of sugar, which is absorbed in the mouth and small intestine. It elevates blood glucose levels, supplying fuel for brain cells and preventing or reversing hypoglycemic symptoms like confusion, weakness, or seizures. Now the sixth drug, naloxone, or Narcan. The dose is 2 to 4 milligrams intranasally, which is most common, and you may repeat that every 2 to 3 minutes. So indications are suspected opioid overdose with respiratory depression. Do not give if people are hypersensitive to naloxone, which is very rare. The route is intranasal, or it can be different routes like intramuscular or IV. So naloxone is a competitive opioid receptor antagonist. It binds to the mu receptor, most importantly, displacing opioids like heroin, fentanyl, or morphine. This rapidly reverses opioid-induced central nervous system and respiratory depression. Thank you for watching.